Hello everyone, my name is Maratush. Today I will deliver a presentation about health promotion program to improve medicine access for people living with diabetic retinopathy in underserved area in Bekasi, Indonesia. Well, this is the outlines of today's presentation. We will discuss further about 9 aspect or 9 point. The first is introduction diabetes as a national burden in Indonesia and analysis of the chosen vulnerable group. And then here the third aims and objective of the health promotion program. And then project plan and program logic model. And then sustainable action following with community engagement and partnership and intersectoral collaboration, some ethical consideration and recommendation and conclusion. Well, ladies and gentlemen, this is national burden of diabetes in Indonesia. As we know, diabetic retinopathy is a leading cause of blindness in developing country. And it's also happened in my country, Indonesia, where Indonesia is a developing country, which is categorized as a low middle income country. And then more than 18% of people with visual impairments live in a low income setting, such as in Indonesia. And as we can see closer to my chosen vulnerable group, which we will discuss further in the next session, here is 97% of the chosen vulnerable group are aged more than 55 years old. That's why, because of two major points here, or two major facts here, it is crucial to plan sustainable health promotion program. Well, this section we will analyze of the further of the chosen vulnerable group, including demographic characteristic, social determinant of health, health literacy, health disparity, and identify gaps and exciting service. Well, this is the chosen vulnerable group, the demographic data, where the vulnerable group is diabetic retinopathy people who are socially deprived, old, low educated, and living in underserved rural area in Bekasi, Indonesia. This is about the geographical location where the 97% of them is living in rural area and have limited access to the health. Here we have a gender demographic data, where the vulnerable group accounts for 75% female and 25% male. And for the age trend, the majority of them are aged more than 55 years old, consists of 42%, as we can see in the pie chart. Well, for the educational background, in here, in the pie chart, 81% of population group are poorly educated, which constitute of junior high school here, 64%, and then elementary school, 17%. For income status, as we can see also here, this is the criteria based on the local government in Cikarang, West Java, Indonesia. This is the situation, their current situation, that 63% of them is in a low income status and 37% of them in a middle income status. We will discuss further about social determinants of health and health disparities. Here we have three major aspects which constitutes to the major social determinants of health for my chosen vulnerable group. Here is such as low income status, middle income status, and then they are old, poorly educated, and living in rural area. Well, ladies and gentlemen, this kind of situation brings them two major difficulty, or we call it health disparities in a society. The first is poor healthcare access and difficulties to affordable medicine. Yep, this kind of situation. Well, before I set up the goals and the objective or aims and objective of the program, here is crucial to identify gaps and exciting service before. Here, the fact that few health agencies providing affordable medicine covered by national health insurance in a local area in Cikarang, and no incentive for local drug in an underserved area, especially for a local drugstore, yeah? And then less accessibility of local drugstore. Also, we found a social gaps here. There's 4 social gaps. First is difficulties to access local health agencies providing affordable medicine, and then difficulties to access local drugstore, and also to medicine access, and the last is low medicine adherence. Because of these gaps and a review of the exciting service before, it is crucial to set up the aim of the project, or the aim of the health promotion project. The aim is to increase the number and proportion of people living with diabetes. 98% which living in Bekasi, Cikarang, Indonesia, who access medicine within 12 months since the commencement of the project. And here we have 4 objectives. The first is to increase participation of people with diabetes in relation to national health insurance registration within 1 month since the commencement of the project. And the second, to increase the number of people with diabetes having national health insurance within 6 months since the commencement of the project. And to increase the number of local drugstore, 1 drugstore in 1 district, located in underserved location within 8 months since the commencement of the project. And to increase the number of health providers who encourage the use of medicine covered by health insurance within 10 months since the commencement of the project. And then this is the model or framework which I use to achieve the goal and objective. This is the proceed model, which consists of 9 phases. Each phase is implemented to the program. In the beginning, we assessing the performing a social assessment, and then followed by epidemiological assessment, educational and ecological assessment, and then in the phase 4, administrative and policy assessment and intervention alignment. And here it's essential that our health promotion program is collaborate with the community partner and a local policy or a local policymaker. In here, why? Because collaboration with partnership or in a community with policymaker also, it will help us to reach this predisposing step, reinforcing and enabling. And this is also can control and can clearly set the behavior challenge, environment, even genetic and health disparity and a quality of life in the society. And after this, we perform an implementation of the program, and process evaluation, impact evaluation, and outcome evaluation will be discussed further in a project plan and program logic model. Well, this is the next slide of project plan. In a project plan, the 3 major input, output, and outcomes, where input, we have a program investment, we have staffs, funders, partner, time, and money. And then in the output, we have activities and participation. In activities, we strengthen the point of the building a capacity of partnership in a community, and work with policymaker in order to set up the local pharmacy or local drugstore. In the participation, we ensure all the policymaker and society is integrated in the same action. And then with community health workers also, health professionals such as doctor, nurse, and also with pharmacy industry. Why? Because pharmacy industry will help us, and will have a program, will have the government, local government also to make a local, to bring a healthy access, or as a drug, for example, drugstore in a community, in a society. And in outcomes, we have short-term, medium, and long-term outcome. In the short term, we want to see the awareness and knowledge is changed regarding to the medicine coverage by health insurance. And then we want to assess further about the how their society knowledge related to the where to access medicine covered by health insurance. And then for the medium outcomes, the increase in the number of drugstores located in underserved area will be evaluated, and the change in policy which incentive pharmacy located in underserved evaluated location will also be evaluated. And for the long term, we want to assess the increase in the number and proportion of people who access medicine. Well, this is my program logic of the program. Here, we have a health problem and health determinants such as poor access of affordable medicine, health determinants such as low income status, old age, low education, and all the participant or targets living in rural area. To overcome this health problem and health determinants, we have to set the goals and objective. Goal and objective I explained in the previous pages, and the main goal is to increase the number and proportion of people living with the retinopathy diabetes in Cikarang, Bekasi, who access medicine within 12 months since the commencement of the project. And also, we use proceed model as a framework strategy to achieve goal and 4 main objectives. And also, in the end of the program, we will perform outcome evaluation, impact evaluation, and process evaluation, where in a outcome evaluation, we will assess the number of proportion of people who access medicine after completion of the program. And in the impact evaluation, we want to see the increased number of the new drugstore, which is established in the underserved area. And in the process evaluation, we will evaluate the attendance rate, of course, of the participants and their attitude toward the program. And then here is in the important stage or important step of the program, health promotion program, is to perform an action for sustainability. This is really crucial because we can see and we can evaluate for the long-term effect, short, long-term, and medium effect from the program. And here is we will assess about health policy. We will collaborate with a policymaker in the local and the national government in order to evaluate or ensure health insurance coverage is enhanced, is used by the society. It can be enhanced accessibility of affordable medicine, and it will minimize health disparity for them. All the vulnerable group will accept the same medicine, will accept the affordable medicine, medicine for all for them, and it is easy to access a local drug in a rural area. And then for community engagement, it is really crucial because it will help promote health promotion successfully in the future. Because community partners, it will promote, educate, and monitor behavior change. Here is community empowerment is the key, where collaboration with community partners such as imam, because majority of vulnerable group is Muslim. Imam is a spiritual figure in Islamic society. It will imam will enhance coping strategy with some procedure also, including Muslim, and it will enhance self-management, because this is the key person in the society. So this key person can make them with an access to the program, because they can motivate the society to change and motivate the society to be better. And then partnership and stakeholder also important, because partnership and stakeholder will ensure that every people in the society has the same responsibility for ongoing delivery of health promotion program. And here, intersectoral collaboration between health and non-health sector is also crucial. For example, collaborative work with policymaker, pharmaceutical companies and drugstore, and community health workers, health professional, and health providers. Here, it is also important to always pay attention for the ethical consideration. There are 5 aspects of ethical consideration for this program. The first is about the justice principle. The justice principle will ensure that the program will be delivered equally, will be delivered fairly, no discrimination such as race and religion discrimination. Every person will be treated equally here. And safety procedure also will be performed. And then fairness, there is no discrimination. It will also support this justice principle. And for the beneficence principle, it will ensure that all the procedure, all the activity in the health promotion is there is no harm within health promotion activities. So there is no physical harm, emotional harm, and healthy risks in this program. And in this program also, always respect for human vulnerability, accept for who they are, and also to enhance personal integrity. Well, this is the last of the presentation about the recommendation and the conclusion. The use of a systematic approach is crucial to promote effective planning, implementation, and evaluating of a health promotion program, which in turn leading to sustainably improve accessibility of medicine in underserved area. Systematic approach is crucial to perform an affordable medicine, and then community partnership and empowerment is also crucial to evaluate and to maximize the program. Collaborative work with policymaker will ensure all the programs such as drugstore establishment is in a good process of the drugstore establishment. And then this also will bring local and national government to set up the new regulation about building a local drugstore, especially in underserved area. Well, this is the end of my presentation. Thank you for your attention. This is for further reading and references. Thank you very much.